Hello, I am Dr. Laxmi Rachkonda, Professor and Head of Department, MJ Medical College. Today I will be describing the intrauterine contraceptive device as a method of contraception. I will be discussing it under the following headings of history, the mode of action, the various types of IUCDs, the contraindications, the time of insertion, the method of insertion and the complication. Now let us go through the history of IUCD. It is seen that IUCDs have been present since ages. The Arabs used to insert pebbles into the uterine cavity of the camel when they were walking through the deserts, and it was found that this intrauterine contraceptive device in the form of pebbles had some effect and prevented pregnancy. Then started the evolution of the closed type of devices, that is the Greffenberg ring and Bernberg bow. But the problem with the closed devices was, once it gets perforated and comes down into the abdominal cavity, the chances of strangulation of intestine are more. So that is why it started evolution, and then the open devices came into the market and the closed devices became obsolete. The advantages of the open devices were, even if it perforates the uterine cavity, there is no question of strangulation because the aperture is very less. Initially, they were inert devices like Lippis loop. Then came up copper containing devices which were medicated. Then there are modifications about the amount of copper, and then came the hormonal devices. So now we have got in the market the copper T 380A, multilode 375 and LNG, that is levonorgestrel intrauterine device, which are the third generation devices. All of them are impregnated with barium sulfate so that they are radioactive. These are the variety of IUCDs which are available in the market. This is copper T 380A, which is in the form of a T-shaped, where there is copper on the horizontal and vertical arm. This is also supplied by the government. Now this is a multi-load in the size of 250, 375, and this is the one which is supplied by the government, and this is a sleek type of IUCD which can be used in the nulliparous, and this is the LNG-IUCD, where this is the shape of the LNG-IUCD. Now we will see the mechanism of action of IUCD. IUCD, because it's a foreign body in the uterine cavity, it causes a non-specific inflammatory reaction. There are some biochemical and histological changes occurring in the endometrium, which are gametotoxic and spermicidal. Because of the inflammatory reaction, there is a phagocytosis which is causing problem to the spermatozoa. In addition to this inflammatory reaction causes the release of prostaglandin and implantation is prevented. In addition to this property, the second way of action is increasing the tubal motility, so fertilization is prevented. Now the copper containing medicated devices also have some action, that the copper also causes some inflammatory reaction and it interferes with the enzymatic action of the sperm. In addition, the thread which is present in the cervical canal or in the vagina will alter the pH and alter the motility of the sperm. Now, LNG containing devices, in addition to some of these properties, cause complete suppression of the endometrium and cause the cervical mucus to become very scanty over a period of time. So, in addition to the contraceptive effect, the LNG intrauterine devices are used in the treatment of dysfunctional uterine bleeding. Now, let us go through some of the contraindications of IUCD. IUCD is contraindicated whenever there is a pelvic inflammatory disease, whenever we have got any abnormal uterine bleeding, previous history of ectopic pregnancy, sexually transmitted diseases, suspected pregnancy, cesarean section within the last 3 months is a relative contraindication. Then very important are the prolapse of the uterus, distortion of the uterine cavity by say a fibroid or congenital anomalies of the uterus. Copper devices are contraindicated in known cases of copper allergy or Wilson disease. LNG containing IUCDs are contraindicated in severe arterial diseases, hepatic cancers and breast cancers. Now, what are the various times when you insert a copper T? The most common time when we insert is called as an interval insertion. That is the interval between 2 menstrual cycles. Now, we generally insert it on the 4th or 5th day. The purpose of inserting on the 4th or 5th day is the internal os is a little open because she is menstruating. The patient does not feel that much pain. In addition to this, we can insert it postpartum, that is 6 weeks after delivery. Nowadays, we insert it immediately after delivery, called as the post-placental insertion, which is called as a PP-IUCD. Now, it can be inserted after a vaginal delivery or immediately during the time of cesarean section. For this, for vaginal delivery, we need a special instrument to insert it. Another time where we can insert is during first trimester MTP, that we insert it immediately after MTP. Now let us have a look at the instruments which are required for the insertion of IUCD. We need a pair of gloves, we need a Sims speculum, anterior vaginal wall retractor, we need a uterine sound and an Ellis forceps, in addition to the IUCD which we are going to insert. The preliminaries to be followed before we insert an IUCD are: the patient should come to the OPD or to the examination table with the bladder empty. A written consent has to be taken. It is completely an OPD procedure where we don't require any anesthesia or sedation, except in LNG where anesthesia is required and expert training is required. We take the detailed history, do the general examination and pelvic examination, so that any contraindications which we have discussed should be ruled out. Now, the patient should be taken and given a dorsal position, and we insert a speculum, and before we insert a speculum, we will load the copper tip. I have already done the PV examination, inserted a speculum, caught hold of the cervix with an Ellis forceps. I have changed the gloves, and now IUCD will be loaded. Now the IUCD is loaded with a no-touch technique, where the horizontal arms are loaded into the inserter. Now the parts of an IUCD are: this is the vertical stem of IUCD, these were the horizontal. The whole IUCD is containing 380 millimeter square of copper, where 314 millimeter are on the vertical stem and 33 millimeters each on the horizontal, and it is releasing 65 microgram of copper per day. This is the guard. It is adjusted according to the length of the uterine cavity. This one is the inserter and this is the plunger. Important thing is, we should load this copper T without opening this package, but because it is being demonstrated, I have opened it. Now the method of insertion is, I will be inserting the copper T, where slowly the inserter will go inside and this guard is adjusted as per the level of internal os. Now slowly it is going into the uterine cavity. It will reach the fundus of the uterus. Once it reaches the fundus, it will be withdrawn a little so that the openings of the tube, at that level the arms will be there. Now have a look at this. This is the plunger and inserter. The plunger will be positioned steadily and the inserter is withdrawn, and when we have a look at that, it is seen that the copper T gets loaded at the level of the fundus of the uterus. Now I will be showing you the dissected part of copper T. This is the copper T with the vertical and horizontal stem with the thread present. This is the guard which is adjusted as per the uterine length. Now this is the plunger which is seen, and this is the inserter. Now let us see the dissected part of multi-load. We can see the difference over here about the knob-like structures of the multi-load. This is the multi-load. It also has got a guard and inserter. Please remember, multi-load doesn't have a plunger and there is no technique of inserting a multi-load. Now we will see the insertion method of LNG-IUCD. It is containing levonorgestrel. The amount of levonorgestrel is 52 milligram. It can be used for 7 years, but it is better to use it only for 5 years. Now, the method of insertion is a little difficult. That is why expert training is required. The parts of LNG-IUCD are the arms of a LNG-IUCD. It has got something called as flange, which is equivalent to the guard, which is adjusted as per the length of the uterine cavity, and there is a slider. Now, when the pack is opened, what is to be done is, we will just push the slider a little bit so that the arms get inside the inserter. Later on, with the inserter, we will insert it through the cervical canal and go a little above, that is 2 centimeter above the internal os. Then the slider is withdrawn up to the white line and the arms open here. We wait for 30 seconds so that the arms are opened fully. Then later on, the inserter is taken slowly till the fundus of the uterus. The slider once again is withdrawn to the complete length so that the arms now get into the uterine cavity. Slowly the inserter is removed and the threads are cut. There is another IUCD called as the frameless IUCD, which is the 4th generation one, which is very important as far as dysmenorrhea is concerned. It will not cause dysmenorrhea. Now let us go through some of the complications which are occurring when we have got an IUCD. The complications are divided into 2 types, the early one and the others are delayed one. The early complications, or we can call them as immediate complications, are syncopial attack, which can occur on the examination table when we are catching hold of the cervix. So to avoid this, we have to explain to the patient what we are going to do, talk to her when we are catching hold of the cervix, so that she doesn't land up into a syncopial attack. The second complication, which is an immediate one, could be cramp-like pains when we are inserting the IUCD. The third complication, which is very common, is perforation, mainly when the uterus is very soft in the post-abortal patient. The delayed complications could be, most common one and which are troublesome, is the increased amount of bleeding or menorrhagia. Please remember that it's a foreign body. It will take some time for the body to adjust to this foreign body. So reassure the patient that 2 to 3 cycles will be very heavy. Only antifibrinolytics can be given so that she doesn't go off somewhere and remove the IUCD. The other complications are pelvic inflammatory diseases, ectopic pregnancy, then there could be expulsion, which is around 5%, and perforation, where it is 1 in 1000. Now there is an entity called as a displaced IUCD. In the follow-up of IUCD, what we do is, we ask the patient to come after the next menses so that we check the thread. Ideally speaking, the patient should feel for the thread daily, but sometimes it is not possible if we have cut the thread a little high up. She has to come for the first month, later after 3 months, and then maybe 6 monthly. In cases of displaced copper-T, if we are not able to find the threads, it is called as a displaced IUCD. The investigations which are done for a displaced IUCD are ultrasonography or X-ray abdomen. Now X-ray abdomen or pelvis is called as sound in situ, that is, we are inserting an uterine sound and taking an AP and lateral view, because in relation to the IUCD and the sound, the position we will know whether it's in a uterine cavity or it is lying outside the uterine cavity. The Lippis loop, which is not used nowadays, is an inert one, so even if it perforates, it is left like that. But the medicated devices cause some reactions in the abdominal cavity, so they should be removed. If the IUCD is displaced and it is still in the uterine cavity, we remove it by doing either a DNC or using a hook or hysteroscopy. But if it is in the peritoneal cavity, we can do a laparoscopy or laparotomy. Now, a little word about the 3rd generation IUCDs, that is copper-T 380A, multilode 375 and LNG. The important advantages are, they have got less amount of side effects, like chances of PID are less, chances of dysmenorrhea are less. They can be used for a longer period of time, maybe up to 5 to 10 years. Thank you very much.